flexing the low back. The nice thing about this position is I have my knee here that allows me to stabilize the patient's leg. And then the other nice thing, which is really slick, I get to this barrier here, and then I have him contract by doing something really simple. Keep your leg up here, don't let your leg drop at all. So he's working against gravity. If I feel like he needs a little bit extra, I can push, but I'm not doing any work really. Shaking a little bit there.
Stabilizers.
It's all that yoga you do.
Yeah, I guess so.
Okay, go ahead and relax. And the nice thing about having the knee there is when he relaxes, he can completely relax because I have him. Move down to the next barrier, we can do the same thing. So that's one way, and that's the way that I might start out on the hip because that's a stronger technique for the hip flexors. It keeps the low back stable and flexed. It doesn't really keep the SI joint flexed. So if the patient was having SI joint pain back here when we were doing this, the whole reason Gameslin's test is part of the SI joint provocation package, then I wouldn't be able to do this as a PIR. So what I could do is have you flip over prone. And this is a much more subtle technique. You're going to not necessarily get, the key with all of these PIRs is you're really not looking for a stretch. So as the doctor, you have to find the barrier. You don't ask the patient if that's the barrier. You find it, you hold it there, and it's subtle. So most of the time that first barrier, patient doesn't even feel a stretch. Maybe even the second they don't feel a stretch. Maybe by the third they feel a little bit of lengthening of the tissue. So you're not going for this, cranking the leg or cranking the knee or cranking the body part into a certain position because we're not actually dynamically stretching the joint. We're actually just stretching the soft tissue. So to make sure I'm not extending the low back, I also want to make sure I'm not extending the SI joint. If I don't extend the SI joint in this position, then there's no way the low back's going to extend. So to do that, I'm going to palpate the PSIS. I bend the patient's knee like this, put their shin on my forearm. If it decides to flop down, that's fine. I have the knee like that. I palpate the PSIS, and I extend their hip until the PSIS moves a little bit, and then I back off. So that's the first barrier. If the PSIS is moving forward, that means I'm extending the SI joint, and I don't want to do that. So I stop before that happens. And then really lightly try to bring your leg towards the table. There we go. And hold that for 6 to 10 seconds or so. Go ahead and relax. Relax. Move it again. Oh, the SI joint, or PSIS started to move. Now I'm starting to get lazy. I can fit my knee under there. That's great. Sometimes I hire an assistant to do this for me. Just for the day. Just a temp work. And I have to do the same thing. There we go. And relax. I like to use my knee to move it. Slowly, PSIS starts to move. That's where I stop. So we're stopping before the PSIS moves. If you're up here like this, look what I just did to his back. That's too high. So I don't know. There are a lot of